Welcome to OET Answers.
Occupational English Test. OET Answers Practice Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. You will hear part of a consultation between a GP and a patient called Mr. Anderson. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, Mr. Anderson. How can I assist you today?
Hi, Doctor. I've been feeling unwell for a few days, and it seems to be getting worse. I thought it was just the flu at first, but now I'm really worried.
I'm sorry to hear that. Can you tell me a bit more about your symptoms?
Well, I've been having chills and a fever. My whole body feels achy, and I've been unusually tired. Yesterday, I noticed my heart racing, and today I've been feeling dizzy and a bit confused.
I see. How high has your fever been, if you've measured it?
It was 39.5 degrees Celsius last night. I took some paracetamol and it came down a little, but not for long.
That's quite a high fever. Have you had any other symptoms, like difficulty breathing, nausea, or pain in any specific part of your body?
Yes, actually. My breathing feels shallow, and I've been nauseous since yesterday. I also have this pain in my lower back that's been bothering me since the fever started.
Okay. That's helpful to know. Did you have any recent infections, injuries, or hospital stays before these symptoms began?
About a week ago, I had a bad urinary tract infection. I was given antibiotics, and it seemed to clear up, but I guess it might not have gone away completely.
Thank you for mentioning that. It's possible the infection might have spread, which can sometimes lead to a more serious condition called sepsis. Have you noticed any swelling, redness, or a rash anywhere on your body?
No rash, but my legs feel swollen, especially around my ankles.
I see. And what about your fluid intake and output? Have you been drinking enough water, and are you urinating as usual?
I've been trying to drink water, but it's hard with the nausea. As for urinating, it's much less frequent than usual, and the urine is really dark.
That's a concerning sign. Reduced urination and dark urine can indicate that your kidneys might not be functioning properly, which can sometimes happen with sepsis.
Sepsis? That sounds serious.
It can be serious if not treated promptly, but the good news is that you've come in early enough for us to act quickly. Sepsis occurs when an infection spreads and triggers a widespread inflammatory response in the body. It can affect your organs and blood pressure if left untreated.
What do we need to do?
First, I'll take a closer look. We'll measure your heart rate, blood pressure, and oxygen levels right away. I'd also like to send you for some urgent blood tests to check for signs of infection and how your organs are coping. Depending on the results, you might need antibiotics through an IV.
Does that mean I'll have to go to the hospital?
Possibly, yes. If your blood pressure is low or your oxygen levels are affected, it's safer for you to be monitored in a hospital setting where they can provide fluids and antibiotics quickly. Early treatment is key.
I see. Is there anything I should do while waiting for the results?
For now, I'd recommend staying hydrated as much as you can. Take small sips of water frequently, even if you're feeling nauseous. Avoid over-the-counter medications like ibuprofen unless specifically advised, as they might stress your kidneys. I'll also arrange for an ambulance if your symptoms worsen suddenly, or if you feel too unwell to get to the hospital.
Okay, thank you.
You're welcome. Let's focus on getting you the care you need quickly. I'll prepare the necessary tests and make arrangements for further evaluation. We'll keep a close eye on you.
Extract 2. Questions 13 to 24. You hear a doctor talking to a patient called Miss Turner. For questions, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, Ms. Turner. I'm Dr. Ellis, one of the physicians here at the clinic. I've reviewed your chart and I'd like to discuss your symptoms with you. What brings you in today?
Hi, Dr. Ellis. I've been feeling really unwell for the past few days. I started with back pain, but now it feels worse, and I've got a fever too.
I'm sorry to hear that. Let's go through this step by step. When did the back pain first start?
It started around 3 days ago, but I didn't think much of it. At first I thought maybe I had just pulled a muscle.
I see. And is the pain localized to one side, or do you feel it across your entire back?
It's mostly on the right side, just below my ribs. It's a dull ache, but sometimes it gets sharper.
Understood. Have you noticed any other symptoms, like pain or discomfort while urinating?
Yes, actually. It started yesterday. It burns when I go, and I feel like I need to pee all the time, but not much comes out.
That sounds uncomfortable. Have you had any changes in the color or smell of your urine?
Yes, it's darker than usual, and I noticed a strong smell.
All right. Have you been experiencing nausea or vomiting?
Yes, a little. I felt nauseous this morning, but I haven't actually thrown up.
Got it. And you mentioned a fever earlier. Do you know how high it's been?
I took my temperature yesterday, and it was 38.5 degrees Celsius. I've also been having chills and sweating a lot.
Thank you for sharing that. Fever, back pain, and urinary symptoms suggest a possible kidney infection, which we call pyelonephritis. Have you had any similar episodes in the past?
No, this is the first time.
All right. Do you have any history of urinary tract infections?
Yes, I've had a few in the past year, but they were mild, and I just drank more water and cranberry juice.
Did you seek medical treatment for those infections, or were they self-managed?
No, I didn't go to the doctor. They cleared up after a few days.
Thanks for clarifying. It's important to know that untreated or recurrent urinary tract infections can sometimes lead to kidney infections, so it's good you came in today. Let's discuss your medical history briefly. Do you have any chronic conditions like diabetes or kidney disease?
No, nothing like that.
And are you currently taking any medications, including over-the-counter drugs or supplements?
Just a multivitamin every morning.
Any allergies to medications?
I'm allergic to penicillin.
Good to know. Have you noticed any unusual fatigue or weakness?
Yes, I've been really tired, and it's hard to get through the day.
That's quite common with infections like this. Now, I'll perform a physical exam to check for any tenderness or other signs around your kidneys. Before we proceed, I'd like to ask, are you drinking enough fluids?
I think so, but maybe not as much as I should.
Hydration is important, especially when dealing with urinary tract or kidney issues. We'll also need to run a few tests to confirm the diagnosis. I'll order a urine sample to check for infection, and we may do a blood test to assess kidney function and infection severity.
Okay. Will I need any imaging?
Possibly. If needed, we might do an ultrasound or a CT scan to rule out kidney stones or other complications. But we'll start with the urine and blood tests first.
All right. What kind of treatment will I need?
Treatment typically involves antibiotics, but since you're allergic to penicillin, we'll select an alternative medication. It's essential to complete the entire course of antibiotics to ensure the infection is fully cleared.
How long will it take to feel better?
Most people start feeling better within 48 to 72 hours after starting antibiotics, but the full recovery may take a week or so. Rest and staying hydrated will help speed up the process.
Okay. Is there anything I should watch out for?
Yes, if your symptoms worsen or you experience new symptoms like severe abdominal pain, persistent vomiting, or confusion, you should seek medical attention immediately. Also, if your fever doesn't improve within a couple of days on antibiotics, let us know.
Got it. Thank you, Dr. Ellis.
You're welcome. We'll get started on those tests right away, and I'll check back with you once we have the results. Take care, Ms. Turner.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a nurse discussing with a doctor. Now read the question.
What a tough week it's been.
Absolutely. The flu season has hit us really hard this year.
Yes, and with the increase in admissions, the wards are constantly full.
I know. We've had to accommodate about 200 extra patients this month alone.
And not just that. Many patients need complex care, and we're stretched so thin. It's hard to keep up with the standards we aim for.
Definitely. I've noticed that some of the staff are burning out, taking longer to recover from their shifts. We've even had a few nurses call in sick from stress.
It's tough all around. But what worries me is that the patient care is being impacted as well.
Now look at question 26. You hear a management of acute respiratory distress syndrome. Now read the question.
Are critically ill, often with underlying conditions like sepsis or trauma, which elevate their risks. Now, if we compare treatment strategies, mechanical ventilation plays a central role, but it's not without risks. Barotrauma and volutrauma can worsen the condition. Our primary focus, then, is on optimizing ventilation settings to balance oxygenation and avoid further lung injury. In this unit, our mortality rates for ARDS are lower than the national average, 32% compared to around 40%. Early recognition and intervention are essential. If we can stabilize patients within the first 24 hours, we significantly improve their chances of survival. In terms of outcomes, those who stabilize early tend to have fewer complications and shorter ICU stays.
Now look at question 27. You hear a practice manager talking about her approach to continuing education and professional development. Now, read the question. When I first started prioritizing professional development, I was overwhelmed by the sheer volume of information available, from regulations to industry trends. But I soon realized that attending conferences and working towards certifications, like the CVPM, wasn't just about gaining qualifications. It's been incredibly helpful in keeping me up to date with best practices, which makes me feel more confident and capable in managing the team and handling challenges. These opportunities have allowed me to network and understand the bigger picture in this field. My employer encourages me to pursue these things, and I always share what I've learned with the rest of the team. Now look at question 28. You hear a dermatologist's discussion with a patient. Now read the question.
So, Mr. Carter, I understand you've been experiencing some unusual skin sensations and lesions. Can you tell me more about what's been happening?
Yes, I feel like there are fibers or threads coming out of my skin. It's been really distressing. I've also noticed itching and sores that won't heal properly. I even brought some fibers I collected to show you.
I see. This condition you're describing sounds consistent with what we refer to as Morgellons disease. It's a controversial condition because there's ongoing debate about whether it has a physical cause or is more psychological in nature. Now, let me ask, have you recently been exposed to any new environments or substances that could irritate your skin? For example, have you handled synthetic fibers or been in contact with certain chemicals?
Well, I work in upholstery, so I'm around fabric and threads all the time.
That's helpful to know. While it's still not fully understood, certain environmental factors could be contributing. I'll need to investigate further to rule out other causes and find the best way forward for you.
Now look at question 29. You hear a trainee nurse discussing with mentor. Now read the question.
Hello, Dr. Miller. I have a patient I would like to discuss with you.
Sure. Tell me what you have.
I have a 40-year-old man who was rushed to the emergency department with a severe allergic reaction after eating at a restaurant. The patient presented with difficulty breathing, swelling of the face and throat, and widespread urticaria. Epinephrine was administered immediately upon arrival, followed by antihistamines and corticosteroids. He stabilized after treatment and is now recovering. However, he was unaware of any prior food allergies.
That sounds like a challenging case. What are your thoughts so far?
I think the key issue here is identifying the specific allergen that caused this reaction. It could be shellfish, peanuts, or even an ingredient in the dish he consumed. I also believe it's crucial to educate the patient on the use of an epinephrine autoinjector and other preventive measures for the future.
I agree. What would be your next steps for managing this patient?
I would recommend referring him to an allergist for specific testing, discussing food labels and cross-contamination risks, and ensuring he is prescribed an epinephrine autoinjector before discharge.
That's an excellent plan.
Now look at question 30. You hear two colleagues talking to each other. Now read the question.
About the 56-year-old patient's retinal images.
Sure. Have you reviewed the retinal photographs?
Yes, I have. I can see microaneurysms, dot and blot hemorrhages, and a few areas of exudates. Aren't these findings consistent with the diagnosis of non-proliferative diabetic retinopathy?
Yes, they are. However, it's important to also note the presence of neovascularization in the peripheral retina, which suggests progression to proliferative diabetic retinopathy. Also, the patient's long-standing history of poorly controlled diabetes plays a significant role in this condition.
I hadn't considered the impact of the patient's diabetes control on the progression of the disease.
That is the end of part B. Now look at part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For question 31 to 42nd, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen.
Extract 1. Questions 31 to 36. You hear a detailed session on male infertility. You now have 90 seconds to read questions.
Hello everyone, and thank you for attending this session on male infertility, a growing concern that is impacting individuals and families worldwide. Male infertility is defined as the inability of a man to achieve conception with his partner after a year of regular, unprotected intercourse. Recent studies estimate that male infertility contributes to approximately 40–50% of all infertility cases globally, making it a significant issue in reproductive health. One of the main reasons this research was initiated was to address the lack of awareness about the causes and treatment options for male infertility. For instance, it is widely underreported that 15% of men between the ages of 30 and 50 suffer from low sperm count, a leading cause of infertility. Other factors include poor sperm motility, abnormal morphology, and conditions such as varicose cells, enlarged veins in the scrotum. Lifestyle factors also play a significant role, with smoking, excessive alcohol consumption, and obesity being key contributors. This project was designed to educate men about their reproductive health and to provide early interventions that could enhance fertility outcomes. The initiative targeted men who were experiencing challenges with conception, but were otherwise in good general health. By increasing access to fertility clinics and improving diagnostic processes, we hope to encourage men to seek medical advice early. The first step of the initiative was an awareness campaign aimed at breaking the stigma surrounding male infertility. This campaign included workshops held in community centers and workplaces, where men and their partners were encouraged to learn about fertility health. These workshops covered topics such as how sperm production works, common causes of male infertility, and how lifestyle changes can improve outcomes. Participants were provided with free health checks, including semen analysis and hormone testing, to identify potential issues. In cases where treatable conditions were diagnosed, such as hormone imbalances or lifestyle-related infertility, men were offered tailored treatment plans. These included dietary and exercise programs, counseling to manage stress, and medical interventions like varicocele repair or hormone therapy. For more severe cases, advanced reproductive techniques such as intrauterine insemination IUI or in vitro fertilization IVF with intracytoplasmic sperm injection ICSI were made available. The impact of this initiative was notable. Within the first year, approximately 5,000 men participated in the program, and 60% reported an improvement in their fertility outcomes. For every 100 men who underwent lifestyle and medical interventions, the likelihood of achieving conception increased by 25%. Additionally, the stigma associated with male infertility significantly decreased, as reported in follow-up surveys conducted with participants and their partners. Beyond personal outcomes, the initiative had broader societal implications. Improved fertility outcomes reduce the psychological and emotional strain on couples dealing with infertility. Moreover, it demonstrated the importance of addressing male infertility as a public health issue, paving the way for more inclusive fertility services. Looking ahead, we aim to expand this program by collaborating with primary care physicians to ensure early referrals for fertility assessments. We also plan to conduct further research to explore emerging technologies and interventions that could benefit men with more complex infertility issues.
Extract 2. Questions 37 to 42. You hear a conversation between a journalist and Claire Jones, expert on infectious disease management. Now, read the questions. You now have 90 seconds to read questions.
Hello everyone, thank you for joining us today for this special interview. We have with us Claire Jones, the National Coordinator for the Global Nurses Alliance. Claire has extensive experience in public health nursing and has worked on the front lines during various outbreaks, including the recent pandemic. Her areas of expertise include infectious disease management, nurse advocacy, and health systems preparedness. Claire, thank you for being here today. Can you start by telling us what inspired you to pursue nursing?
Thank you for having me. Nursing appealed to me because it's such a dynamic profession that allows you to make a real difference in people's lives. During my training, I realized that nurses are at the heart of healthcare systems. They connect patients with services, guide them through care, and often advocate for their well-being.
Absolutely. It's clear that nurses play a critical role in healthcare. Now, during the pandemic, we saw extraordinary challenges in the healthcare field. What do you think was one of the biggest challenges faced by nurses during this time?
Without a doubt, the sheer demand for care during the pandemic was overwhelming. Hospitals were pushed to capacity, and nurses were often left working in unsafe conditions due to a lack of personal protective equipment. This created not only physical, but also emotional stress. Nurses were constantly worried about bringing the virus home to their families, while also struggling to provide the quality care their patients deserved.
I can imagine how difficult that must have been. Were there other major challenges, such as staffing or burnout?
Certainly. Staffing shortages became a major issue, especially as many nurses themselves fell ill or had to quarantine. This meant that those who remained on duty had to take on extra responsibilities. The long hours and high emotional toll led to significant burnout. In some cases, nurses chose to leave the profession altogether, which exacerbated the staffing crisis even further.
And how did these staffing issues affect patient outcomes?
Unfortunately, the lack of adequate staffing meant that patients did not always receive timely care. For example, in critical care units, where every second counts, delayed responses could have life-threatening consequences. Research during the pandemic highlighted a direct correlation between nurse-to-patient ratios and patient survival rates.
That's a sobering reality. What about support systems for nurses? Did hospitals or organizations step up to provide assistance?
Some organizations did try to help by offering mental health resources, counselling services and hazard pay. However, many of these measures came too late or weren't enough to address the scope of the challenges. The truth is, the pandemic exposed significant gaps in how we support our healthcare workers during crises.
It sounds like there's a lot we can learn from this experience. What do you think should be done to better prepare for future crises?
Well, there are several key takeaways. First, we need to ensure that nurses are equipped with the resources they need, including adequate protective equipment and staffing. Second, governments and healthcare organizations must invest in nurse training for crisis scenarios, so they feel prepared and supported. Finally, we need to prioritize mental health support and recognize the importance of sustaining the workforce during emergencies.
That's very insightful, Claire. Thank you for sharing your experiences and perspectives.
That is the end of Part C. You now have 2 minutes to check your answers.